My name is Lyle Murphy, the founder of the Alternative to Med Center, and today we're going to be talking about Topamax. First question is, can you use Topamax for migraines? Yes, actually, that is what the FDA approves. Next question, what are the long-term side effects of Topamax? Actually, the long-term side effects are rather rare, but they can include high levels of ammonia in the blood, which can cause brain swelling, high levels of acid in the blood, also kidney stones, and possible glaucoma would be some of the long-term ramifications that would be concerning with Topamax. Next question, can Topamax cause permanent damage? Well, any of the aforementioned are going to be somewhat permanent. Most of the more common side effects, including numbness, tingling, fatigue, cognitive delays, confusion, those should not turn into long-term effects, especially if the medication is discontinued. Next question, is Topamax used for depression? Depression is a rather broad-based term. They use depression with the terminology bipolar depression. Really, the depression is not like if they were using Topamax for depression, it would be for bipolar depression, and it would be off-label. And it wouldn't be to treat the depressive side. It would be more to treat the manic side of things. So realistically, as far as like the depressive side, Topamax could actually worsen someone's depression by making them more lethargic and more sedated. Next question. Can you use Topamax for weight loss? Well, interestingly enough, Topamax is associated with weight loss in approximately 16 to 17% of the people because it reduces your appetite. The FDA has not approved it for weight loss medication, and there's probably better ways to lose weight than taking a drug like Topamax. Can you use Topamax for anxiety? Off-label, you can. It is a reasonable anxiolytic. Sometimes it's used to help bridge people away from the use of stronger medications like benzodiazepines, hopefully in an intermediate step to help people get completely off of medications. But it does have, it's a type of drug that will likely reduce someone's anxiety. How long does Topamax stay in your system? The half-life in a normal adult with normal liver function is 21 days, which is slightly, of course, less than 1 day. Realistically, it probably would take about 4 days to get out of your system enough to be clear of it. How can you flush Topamax out of your system? So I'm not quite sure of the intent of this question. If someone ODs on Topamax, they should probably call emergency services and get that handled. If it's just more of a case of you've taken Topamax and you don't like the effect, it's got you too sedated, or it makes you feel really dizzy and spinny, or some minor symptoms, well, those should abate, within 21 hours. But you can drink a lot of water. If it's a sedation issue, maybe you can drink coffee or something to try to help bring you out of it. But if you've overdosed on it, or you think you're having some sort of adverse reaction, then you should consult emergency services. Next question, what are Topamax withdrawal symptoms? So there's quite a laundry list of these, and I have a list here that I pulled directly from our website. If you go to alternativetomeds.com, there's a search bar either on your phone or on your desktop that you can type in Topamax and look for the article called Topamax Withdrawal Symptoms, and we go into quite a bit of detail around that. But one of the most concerning, especially for people who have a seizure disorder, if they rapidly come off of Topamax, they could have a seizure. They could have a rebound effect from migraines. So a lot of drugs, including things as innocuous as antihistamines, can have a rebound effect. So you sort of get the counter of whatever the medication was trying to abate, come back in a more amplified way. Rebound migraines might be one of those things. Obviously, you might have an increase in your weight because your appetite will come back. You might have insomnia. You might have some mood swings, irritability, crying spells, anger, kind of more on the aggression side of things, but also potentially a depressive phase. Anxiety can come up with it, panic attacks. Those are the main things to look out for, but there's a lot more symptoms than that. Usually they're going to be in the realm of you're feeling overstimulated. Next question, what are some of the common Topamax or Topiramate side effects? There's common ones and there's ones that are not quite as common. I'm going to run through sort of them as a grouping. Suicidality is one of the side effects. It's not that common, but it's on the list of side effects. Depression, that would be a common one. Fatigue would be common. Difficulty with concentration, focus, and memory would be common. Mood problems, which would be, more probably in the depressive side of things as a result of taking the medication. Paresthesia, which means like tingling of the toes and fingers and maybe the skin or other parts of the body. That is not highly common, but it's not rare. Psychomotor disturbances like your muscle movement, your ability to control your body might be altered. That one's not particularly common, but it's not uncommon either. Impairment of taste sensation, dizziness, insomnia, somnolence, burst effects when used with pregnancy, feeling extremely hot in your body, cognitive dysfunction and confusion, this would be a common one. Anyway, the list kind of goes on and on with that one. Some of the more rare ones would be metabolic acidosis. And as opposed to being hot in your body, it can also cause you to be very cold in your body, especially when used with Depakote, also known as valproic acid. And I believe that is the rest of our questions. You can go to the website and find out more information. We do have a page on Topamax that even if you typed in Topamax withdrawal symptoms on a Google search function, I believe we're right up near the top for that information. So I encourage you to be directed to that if you have more questions. And I thank you very much for watching this video, and have a good day or good evening.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.